The Center for Family Medicine is proudly celebrating over 50 years of serving our community. The residency itself was started in 1974 with Dr. Richard Allnutt's practice. So he had the vision to actually take his practice and initiate a training program. And over my time here, I've had the amazing opportunity to have a chance to work with some of the very first residents who started here at the Center for Family Medicine, somewhat blazed a trail for us as they helped create the education, the curriculum.
My name's Todd Cook. I'm a retired physician. It's part of the first residency program here. The first Center for Family Medicine was built in 1975, was formerly known as the Family Practice Residency Center. The program itself started in 1974. We were the very first class to be brought in. I think the entire intent, as I understood it, was to bring in and supplement the primary care needs of the community. There were 4 of us selected that year, and then 8 other rotating interns. Again, with the same intent, to bring people to the table. It was just it was a one-on-one and experiential type of thing.
There are honestly not that many programs around the country that are that long-lived, that have been doing this so successfully for such a long period of time. And it's amazing when you think about what this residency has contributed to the medical community of Northern Kentucky. It's staggering.
Well, I would say that while the mission and the goals of the program have stayed roughly steadfast through the time, certainly the services we provided have also evolved over time. I think we certainly have always provided all of the commonly needed care to patients of all ages, whether that's the health maintenance and guidance, and skin procedures and joint injections and women's care and procedures and the basic ultrasound and x-ray. But it's also sort of led through the years by adding additional areas, supplemental areas of expertise and procedures.
My name is Bill Rogers, and I've been a patient here for 31 years. What motivates me to come back is the doctors, the way you're treated. You don't have to sit for hours in the waiting room. I mean, you get in on a timely fashion, you get in, you get out. But just the attitude of the doctors, that's I mean, you can't find that just going out to another doctor's office that you don't know anything about. And I drive about 50 miles each way to get here, but it's worth it. It's worth it.
My name is Dylan Powell. I've been a patient here for really as long as I can remember. I'm still a patient here, and really what brings me back is the youthfulness of the place. I like that they're all residents, they're all my age, which is really exciting and fun to me. I also think that I get really good care here. Being a patient at the Center for Family Medicine really influenced me to go into medical school and pursue a career in medicine because, you know, I saw what kind of doctors they were. I saw that they were youthful, I saw that they were fun, I saw that they cared about their patients, and I really resonated with that. So I really felt like I could mesh well with that, and this career was, for me, I think it's exciting to know that I'm not only helping myself, I'm helping them, I'm also helping patients in the future, because these docs are gonna leave here, they're gonna go somewhere else, they're gonna go help, you know, a plethora of other people. I think it's really exciting knowing that I'm part of that help. I think it's really fun to know that.
We do everything that is like classic, full scope of family medicine. We also, one of the really important things that we do here is we also follow all of our office patients into the hospital if they get admitted to the hospital. So our residents learn office-based primary care and procedures here, and we learn to take care of our own patients in the hospital, and they learn a whole host of hospital-based care and procedures.
So I knew that looking for a training program in family medicine, I didn't want there to be any questions about the breadth of my training or the depth of my training. And this place had a reputation that, yeah, you're gonna be an excellent outpatient family doc, which is what most of us want to be, but you're also gonna be, have this really unique training that no one will ever be able to take from you, right? You're gonna be in the hospital, you're gonna be running rapids and codes, and you're gonna be delivering babies and being that primary person that people look to whether it's a sore throat or a cough, or whether they're really sick and they're hospitalized. It's going to be you. And so I think that's what this program really delivers on, is that training that is unquestionable. We've seen a lot of stuff.
I would say an important part of our role here is to create an environment that really encourages a commitment to our patients through ongoing teaching and learning, really for all of us. So creating that environment where we are committed to becoming the best staff and the best doctors, so that we can provide that best care to these people who've entrusted their health to us. And as we look forward, I anticipate seeing the Center for Family Medicine continue to lead the community of primary care in training physicians to utilize the latest in technology and methodologies and research, whether that's utilization of artificial intelligence or more involvement in research protocols throughout the community. We'll look for the opportunities to take the leading edge to improve the care of our patients.
So for the team here at the Center for Family Medicine, when they're celebrating over 50 years, I want to say thank you, first of all, right? Because this team has given me the opportunity to learn in a beautiful place, a beautiful environment that's full of support.
Just keep doing what you're doing. Keep training great, fun, young physicians who have a passion to give back and help.
I'd like to thank all of the staff, graduates, faculty, and current residents that have meant so much to the Center for Family Medicine for over 50 years. I'm so proud to be part of that.